Hello friends and welcome back to my channel. In this video we are going to talk about pneumothorax, Turner syndrome, schizophrenia, reactive arthritis, urethral traumas and epilepsy or its treatment. So let's start. Pneumothorax. Pneumothorax is a condition where the air accumulates between the lung and the chest wall, which is called the pleural cavity. This can cause a part or all the lungs to get the collapse very easily, which is also known as the atelectasis. And let's see the symptoms. So the symptoms in the question will be given sudden symptoms like very sudden and sharp pain which is happening in the patient, shortness of breath, tachypnea, tachycardia, cough, and cyanosis, fatigue, diminished breath sound. These are the symptoms which we will see. A hollow sound, this is something important finding. When the air will be trapped inside the pleural cavity, we are going to hear a hollow sound. So let's see the questions, you will understand it better. One more thing to highlight here is valvular pneumothorax, tension pneumothorax, spontaneous, they all are the same categories. So spontaneous, valvular or tension, these all pneumothorax are of the same category, in which what happens is the air gets trapped due to some trauma or due to some another problems. The air get trapped inside the pleural cavity but cannot escape. So when the air will get filled, let's hear to the story, a little bit story right now, so that you can remember it for the long terms. So what happens is some trauma happened, and due to which the pleural cavity got filled with the air, and the pleural cavity when filled with the air, so it will increase in the size. Yeah, so when the size of the pleural cavity will increase, it will cause the congestion with the size of the lungs. So what happens is atelectasis, or lung will get collapsed because the pleural cavity is increasing in size and the lung will get collapsed. Also we are going to see the tracheal deviation when there is too much congestion over there in the thoracic cavity, so the trachea will get deviated to opposite to the affected side. Distended neck veins, hypotension, low BP, these are the symptom of valvular tension or spontaneous pneumothorax. Let's see what are the patients complaining of. First case is the pneumothorax. Pneumothorax is what it is. Pneumothorax is here. So when the air and pus both are filled in the pleural cavity, this is something known as pneumothorax. So remember, sometimes the question will give you the history for the bacteria. Let's see. The 32-year-old patient having acute abscess in his right lung felt pain in the right half of the thorax after coughing and got heavy breathing, cyanosis. What complication arise? So sir, the abscess was already there, the bacteria was already there, and now the patient feels sudden sharp pain in the right half of the thorax, got heavy breathing and cyanosis. So the question is asking about the complication. What complication occurred? Pneumothorax, but since the bacteria or abscess is there, so you are going to mark pneumothorax, which is the blood as well as pus together in the pleural cavity. Next is sustained blunt trauma to the chest, cause of acute cardiopulmonary collapse. So when trauma is there, the pleural cavity would have got filled with the blood or with the air, for example. What happened is atelectasis, I told you, the pulmonary collapse, the lung got collapsed because pleural cavity has increased its size a lot, caused a congestion which will cause atelectasis or lung collapse. So this is the case of pneumothorax. Next is open pneumothorax and closed pneumothorax. Let's define them. So open pneumothorax is a large open wound allowing the free communication between the pleural cavity and outside. So it's like a hole in the pleural cavity that the air is entering freely and escaping freely. Closed pneumothorax will lead to the collapsed lung. So when there is closed pneumothorax, in the air when get filled in the pleural cavity, the lung will get collapsed. Let's hear to our next patient. Next patient says about the dyspnea getting worse during physical activity. Presentation appeared suddenly. 2 hours ago at the workplace, acute chest pain in the left cough. Pain was abating, but dyspnea, dizziness, pallor, cold sweat, cyanosis were progressing. Vesicular respiration is absent. So, friends, vesicular respiration is the normal respiration. We termed it in the medical term that vesicular respiration is normal respiration. So they say vesicular respiration absent. It means on the one side of the chest cavity the respiration is not at all over there. So what would have happened over there? So the lung got collapsed. All right, the lung got collapsed. That's why we cannot detect the respiration over there. Another finding is suddenly started. So the pain started suddenly with the cyanosis are there, pallor is there, cold sweat. The patient's condition are grave over there, and the x-ray also shows a shadow on the left. So what pathology happened in the patient is a spontaneous left-sided pneumothorax. Next patient had a road accident which is getting worse with the respiratory insufficiency progressing. There are cardiac abnormalities since the cardio and pulmo system works together. Mediastinal displacement is there. So what would have occurred over there? So when the patient got the road accident, so he got something with his pleural cavity, due to which the air some hole in the pleural cavity, due to which the air is getting filled in the pleural cavity. Pleura is the space, pleural cavity is the space around the lungs. So around the lungs, the outer layer covering is pleura. So when the air is getting filled in that space, what will happen, sir? The pleural cavity will increase its size and cause the lung collapse plus the tracheal deviation. This is the case of tension pneumothorax, valvular pneumothorax, or you can say spontaneous pneumothorax. So remember, in such cases, guys, the air can trap but air cannot escape the pleural cavity. So the tension pneumothorax was not given in the question. Given option was valvular pneumothorax. So have to remember that spontaneous, valvular and tension pneumothorax are the same cases in which the air get filled or air get trapped in the pleural cavity, which will not be able to escape. Next patient, acute pain in the right half of the chest and developed after going upstairs on the third floor. Cough, dyspnea at rest, marked cyanosis, complication. So the examiner is asking about complication. So whenever this much grave condition are there, so the patient had pulmonary tuberculosis. So what exactly happened right now is more complications. So acute pain in the while going the upstairs to the third floor, dyspnea, marked cyanosis, the case of spontaneous pneumothorax. The next patient, this is also something important finding. Severe pain on the right side, dyspnea. The main important find is objectively right side of the chest lags behind in the act of breathing. Sir, right side, why the right side of the chest is lagging behind? Sir, because the left lung is supposed to be okay, left lung is fine, which is breathing, which we say as vesicular respiration. The left lung, as the right side of the chest lags behind. So the left lung is breathing normally, but the right side is lagging behind in the process. So this is something like a finding typical for pneumothorax. It can occur in more pathologies as well, but some of the important finding for pneumothorax is because the lung is getting collapsed, or so due to this the one side of the chest will lag behind. So percussion revealed tympanic sound. So what is this tympanic sound, sir? Tympanic sound means when they are trying to auscultate the lungs, so they are detecting some sort of drum type of sound. So this is basically because of the air is filled inside the pleural cavity. So when we will do percussion over there, the tympanic sound we will hear, which is something like a drum type of sounds. And auscultation revealed the diminished breath sounds. Sir, why diminished breath sounds? Because the lung is getting collapsed. On the right, pulse is this, arrhythmic, BP is low, cardiac sounds decreased because the cardiac and pulmo system works together. What do you suspect? Right-sided pneumothorax. Let's see our next patient. Next patient is the history of streptococcal destruction, and then right side of the lung lags behind in the respiratory act. Percussion detects dullness in the lower parts. Why dullness, sir? Why this time there is no tympanic sound? Sir, because in this case the fluid is filled over there because streptococcus is there, so might be abscess or some sort of fluid over there in the lungs. Yeah, that's why there is dullness in the lower part of the right. Band box resonance in upper part. In band box resonance means the air is over there in the upper part, but the fluid is there on the lower segment of the lung. So what is the case, sir? Pneumothorax. But exactly what case, sir? Pneumothorax. Why? Because infection is over there, the streptococcus is there. So in the lower segment of lung, pus is there, and in the upper segment of the lung, air is there. So when air and pus are together, this is the case of pneumothorax. Let's see our next patient. So next patient also complained about the acute sudden chest pain, diffuse cyanosis, tachypnea, right-sided thorax is enlarged but doesn't participate in the respiration. I hope you understand, guys. This is also a case of spontaneous pneumothorax. The sudden findings are there. The right side of the thorax is enlarged. And why enlarged? Because the air got filled over there, and doesn't participate in the respiratory process because the lung got collapsed over there. Sir, percussion on the right revealed the tympanic sound. Why tympanic sound? Because the air got filled in the pleural cavity. Next patient is a pulmonary abscess plus pneumothorax is pneumothorax. You know it by now. 10th patient is having a femur fracture, multiple rib fracture, brain contusion, hemothorax. What injuries are requiring most urgent attention? Sir, hemothorax and rib fracture is the most serious case here, because if the hemothorax is not solved immediately, the patient is going to be die out of dyspnea. The lungs will get collapsed, so very shortly the patient is going to die. So the first tactics of our doctors should be hemothorax, the correction of the hemothorax, or the option said multiple rib fracture and pneumothorax. So this was the urgent. However, femur fracture can wait for the treatment. Hemothorax is blood accumulation in the pleural cavity. Percussion will reveal the dull sound because blood is there. Sir, 11th patient. This is a 7-year-old boy. Says what? Got fall from the height, rapid shallow breathing, cyanotic phase. The right half of the thorax is distended. Distended means a bit outside, a bit bulged or outside. Takes no part in breathing. So why? Because of lung collapse. Clinical present and instrumental right-sided tensile pneumothorax. Right. Percussion detect tympanitis, drum-like. I have written here, drum-like air-filled is drum-like sound because of the air fill. And the main findings here are thorax is distended, takes no part in breathing. Clinical presentation says instrument percussion detect tympanitis. Okay, so what you are going to do for the right sided pneumothorax? Sir, we are going to do the chest x-ray, because we will be able to see the size of pleural cavity is increased, the lung got collapsed, and some of the opacities on the x-ray. Let's see the next patient. 12th patient says the subcutaneous emphysema was observed in the area of the patient's neck and upper chest. Over the right side, the bandbox resonance can be heard. Respiration is absent there, sir. What case is that? This is the case of spontaneous pneumothorax. The findings main for this question are the respiration is absent in one side over the right lung. The bandbox resonance is there, so air is there, right? I've told you that bandbox resonance means some air is filled over there. Yeah, drum like sound on percussion. So I hope you understand pneumothorax very well. So next is Turner syndrome. Turner syndrome is the genetic disorder that occurs in female characterized by the partial or complete absence of one of the X chromosome. So what we are going to see as a karyotype of the patient, we will see that patient is not having 46 chromosome. The patient is having first of all 45 chromosomes, and the karyotype, full karyotype 45 XX will not be there because one of the X chromosome will be missing in the patient. So the X character will be a bit reduced in the patient. So the karyotype which we are going to see 45 comma X0, X0, or some people say XO, because one of the chromosome will not be there. The total number of chromosome in human are 46 plus X chromosomes, X or XY chromosomes. So symptoms which you are going to see is short stature. Marfan syndrome was tall stature. Turner syndrome is short stature. And next is webbed neck. We are going to see in the patient, like the neck will not be enough in size. The neck will be very short, like the patient will look like, imagine how the webbed neck patient will look like. Low set ears, broad chest with widely spaced nipples, shortened metacarpals, because the patient is having a short stature in Turner syndrome. Cardiovascular issues, kidney, skeletal development issues. So let's see how the patient looks like. That's a girl. First of all, Turner syndrome occurs in female only, right? In male it should be Kellenfetter. In female only Turner syndrome. So here you got the karyotype which you were looking for. You can read the whole question. Let's see the next is schizophrenia. So schizophrenia is chronic and severe mental disorder that affects how a person thinks, feels and behaves. So the stupors which coming under the category of the patient are catatonic stupor or paranoid schizophrenia. These are the main things highlighted by the Croc examiner. So I decided to define them for you before we move to the questions. Catatonic stupor is something no response to the environment or vexy flexibility. Sir, what is this vexy flexibility? So vexy flexibility, what it is, when the patient will acquire some difficult position. I'll try to throw a reel on YouTube as well so that you understand through the photos. But for now, remember that vexy flexibility is something that the patient will take some difficult postures and positions, and the doctor or the therapist or the psychiatrist will try to change his posture. But the vexy flexibility means what? That he got stuck there, and he will not be reacting to the therapist anymore or psychiatrist anymore. So this is something unusual postures or difficult posture, and the patient can stay in such postures for a very longer times. Like we will be shocked to see the patient with the catatonic stupor and vexy flexibility, that the patient is lying on the bed with one leg elevated in the air, like the Lissage test, straight leg test. So that elevated leg, one leg, it should get painful for us within 1 minute itself. Like when we do exercise and elevate the leg while lying on the bed, we feel the pain within 1 minute itself. However, schizophrenia patients are having this mental disorder, that vexy flexibility, they will keep that leg raised for the longer time. However, unusual postures describe the definition well. Paranoid schizophrenia, sir, what is this? Paranoid schizophrenia is the patient will have some delusion, some sort of hallucination, auditory, or he will suspect a lot. So when you will hear the case, you will understand it better. So I'll let you know about it. So symptoms of schizophrenia basically are neuro symptoms most of the time. So positive symptoms, hallucination, delusions. Like sir, what are positive symptoms? Like this is a neuro disorder, mental disorder. So what are the positive symptoms? Sir, positive symptoms means they are still okay. Let's see the negative symptoms. Negative symptoms of schizophrenia are social withdrawal. The person will not even call friends. The person don't want to talk to the relatives. The person don't want to talk to the friend. No more shaking hands with the friend because he's fine alone. Affective flattening means emotional express. The patient will not express his emotions to anyone. He will get himself a corner, and here he will keeps on sitting over there, and no more talking with relatives, no more friends. So the patient will feel the social isolation. Social withdrawal is there. Loss of activities once enjoyed. Once you enjoyed that giant wheel, so you don't want to enjoy it alone, again. So basically this is what is the some of the finding in schizophrenia, that if some interesting activity the patient has done already, so he will not find it interesting again. Lack of motivation. Cognitive symptoms: attention and concentration problem, working memory problem, difficult decision making processes. So let's hear it from the patients. First of all, the schizophrenia patient is not going to come to you because the patient thinks that he is perfectly fine, he is okay. This is something which is reported by the family members or the friends or the students living in the classroom. When they see their friends behavior is changing, something very typical for the psychiatric disorders. So let's hear from the patient. 16-year-old patient, behavior gradually got changed. So behavior of the patient got changed. He no interest in the communication with friends, in learning, become indifferent towards the relations, motiveless, rude, was speaking or laughing to himself. So as I told you, the patient will find himself a corner and he will be happy alone. So he'll not like to share why he's laughing. So answer the question correctly. Consider himself to be healthy but a little bit tired. Says that he is thinking about writing a book. Projection of humanity on the plane of universe. Even the book is full of daggers which he is trying to write. So this is the profile of schizophrenia, the mental disorder. Next patient, our vexy flexibility. Let's see how the patient looking like with the catatonic stupor. So patient movements are retarded. She answers no questions. She's just like vexed up, like she's don't want to move. She's feeling so happy in that posture. So she stay in the strange postures. It is possible to set her body, limbs into different positions artificially. If the psychiatrist lifts her arm or leg so that she remains standing on another leg, she can stay like that for very long time. Which disorder is this? Sir, this is schizophrenia and catatonic stupor. When you see vexy flexibility, the psychiatrist is trying to change his posture. Like if the patient got his leg elevated for a longer time, the psychiatrist is trying to remove that posture, but the patient is not agreeing to that. However, you can adjust the, like if right leg is raised, you can now raise the left leg of the patient and put the right leg on the stage of resting. So it will be easy to alter the posture, but the patient will stay in such posture only and would not love to speak anything about any question, will not answer to the questions anymore. Next is I have wrote something in the corner. Next is epithenic stupor. This is just for the information, guys. I find it important to just write in a corner for myself. So epithenic stupor is lack of motivation, fixed posture, diminished speech. However, you will remember the cases of schizophrenia very well. So next patient is also having what? Next patient says in the third line, next patient quit his job, stopped caring about his child, went out carelessly dressed, so naked or half naked, something like that. Voices in his head. Patient claimed that he's sure that he is an ambassador of God on earth. So wow, this is so the patient profile looked like this with schizophrenia, that he is having some sort of hallucination, the auditory hallucination, or not the auditory but the voices in the head. Yeah, the hallucination, we termed it as in the voices in his head. So he is sure that he is the ambassador of God on earth. And so this is the profile for the. So one more thing is to highlight in this question is the patient quit his job. He don't care about the job anymore. He stopped caring about his child. So when we were talking about that, the patient doesn't want to contact relatives, the patient doesn't want to contact his friends anymore, he just want a corner. So this in this case, this 30-year-old carpenter don't even want to care about his child. So remember about the typical case for schizophrenia. Next, our patient is 28-year-old, mental disorder since 22. Conditions changed actually from the 3 days. From 3 days, the patient is refusing to leave the home, claims that a telepathy occurring between him and other people, through which he received the thoughts of strangers and transmit his own thoughts to the others. So telepathy is something known as this one. So the patient is having severe hallucinations this time, that he thinks that my thoughts can be transferred to the other people easily. This is a telepathy, and other people thought are coming to my brain without any connection. So this is telepathy. So this is the case of paranoid schizophrenia. So I hope you will remember easily. This catatonic stupor is related to the vexy flexibility, and paranoid schizophrenia is related to the auditory or hallucination or delusions. So let's see our next patient. Next patient is having he doesn't answer the any question, and he is having vexy flexibility of the muscles. So sir, this is the case of catatonic schizophrenia because we got our vexy flexibility in the question. So the last thing about schizophrenia which you have to remember in the question, that according to Kroc, the first line treatment for schizophrenia are neuroleptics. This was also the question of the Kroc. I've written it here for you, that first line treatment for schizophrenia is neuroleptics. One of the neuroleptics is risperidone. I hope you remember it. I'll try to share some photos in the Reels section. Guys, if you are not watching my shorts on YouTube, so shorts are all of the shorts which I have provided in the Reel section or short section, they are related to the topics itself, the X-ray findings, or how to treat the treatment finding, how to treat, or the how the investigation should be done. So this is for your photogenic memory. So after you watch the video for any of the topic for my video, so you can go to the Reel section and find some photos of related to the topic, so that the topic will get strongly in the long-term memory of yours. So I hope schizophrenia is clear now. Next is reactive arthritis. So reactive arthritis is a type of inflammatory arthritis that occurs as a reaction to an infection. So a bit similar to sepsis. So reaction to an infection in another part of the body. But the thing is, in this case, in sepsis, we know that sepsis is a reaction to an infection. So the body chooses to react in that way that it will lead to the widespread inflammation as well as organ failure. So in cases of reactive arthritis, the problem is in one part of the body, but the reaction will be in some different part of the body. You will understand through the questions very well. So just come to know about what is reactive arthritis exactly. So the problem or the infection is will be in the one part of the body, but the reaction will be in some another part of the body. So let's hear it from patient. It is caused by chlamydia. Most probably it is very common thing that the question sometimes will not give you chlamydia directly, but you will have to understand through the question that it is the highlight to find the chlamydia. Most of the time the question will say that the patient is having a lot of sexual partners or a lot of sexual relationships, and the patient is rarely using a condom or not using the condom at all. So sir, this is the case where these are the words where the question want to highlight the chlamydia. This is common in SCD. So symptoms which we are going to see in the patient are joint pain, urethritis, conjunctivitis, skin rashes. Sir, all of them are explained in brackets. Please have a look over them. However, the question, let's see how the patient complains. So a 25-year-old patient which is who is not married has sexual relationship with several partners. So you already know from the introduction portion about this one, yeah. And last 3 months noted small amount of mucoserous secretions from the urethra. So urethral discharges are there. Suspect chlamydia. Periodical itchy burning pain in urethra. 2 months ago, pain in knee joint. Sir, the discharges from the urethra but pain in knee joint. Why, sir? The infection is in one place, the reaction is in different place. So during the last week eye discomfort is noted. So urethra findings, the urethral findings, as you remember from the question, findings will be urethral, ophthalmological, skin, joint, and tendon and ligament finding. So sir, this is very well highlighted in the question about the patient not having safe sexual relations. The discharges from urethra, sir, itching, burning, 2 months ago, pain in the knee joint, and eye discomfort is noticed. So ophthalmological finding. Sir, this is very defined case of reactive arthritis. Next patient is also having what? Pain in his toes 1 and 2 on the left foot, reduces redness of the eyes and purulent discharge from the painful urination, severe sexual partners, and rarely use a condom. So the patient is not having safe sexual relationships. And examinations are conjunctivitis, ductilities of toes, ES are elevated because of arthritis or let's say infection somewhere. X-ray shows joint space narrowing. So findings are the same in this question as well. Joint findings, conjunctival findings, ophthalmo, and what else is there? Yeah, the joint findings, the urinary findings, urinary is there, yeah, inflammation of urethra and painful urethra. And safe sex the patient is not preferring. So sir, this is the case of reactive arthritis. I hope it is clear now. Let's see urethral trauma. So urethral trauma will lead to injury to the urethra. Symptoms which you will see, any trauma, sir, symptoms you will see, blood is there, if the patient cannot urinate, pain is there. If the patient tries to urinate, it is the urine is containing a lot of salts and a lot of products. So if there is any injury to the urethra, it will lead to severe pain. The patient cannot urinate. If he try to urinate, it will lead to severe burning sensation, leakage of urine into the surrounding tissue. So let's see the patient complaint. Patient says that 42-year-old patient was delivered to the trauma department. X-ray shows pelvic fractures. Objectively, urination is not possible. Sir, why it is not possible? Sir, because trauma got there. One thing it says urethragia, which is abnormal discharges of blood from the urethra. It should be urethra, independent of urination. So urination, if the patient is trying somehow, so that is different, but the abnormal blood discharge are occurring also in this patient is different findings, sir. So what you are going to diagnose, sir? We are going to diagnose urethral trauma, epilepsy. Next, let's go next. Epilepsy means seizures, and so this is a neurological disorder characterized by the recurrent seizures. Can be due to abnormal electrical activity in the brain. Yeah. So the main thing in the croc question, they are asking about status epilepticus again and again. Sir, what is this status epilepticus? So when the person is having experiencing prolonged seizures without regaining full consciousness between them. So the patient had a seizure right now, yeah, but the seizure is stopped right now, but the patient is still not into the consciousness, and the second seizure has started already. So between the two seizures, the patient is not going to get back to the consciousness. Partially or full depends on the patient's condition, but the patient will not get full consciousness back from the comatose stage or stupor stage. So let's see the patient. A patient had 4 generalized convulsive seizures within a day. Between the seizure, the patient did not maintain clear consciousness, was in coma or stupor. His state is status epilepticus. Next patient says about the 40-year-old woman suffering from epilepsy since she was 15. Generalized epileptic seizures occurs 2-3 times a month at night and accompanied by involuntary urination, defecation after a father's death. This is something mental trauma for her. After the father's death, after this severe mental trauma, her attack became more frequent and now occur every second to third minute. Woman does not return to consciousness between the attacks. So what case is this? Status epilepticus. Sir, why? Because the woman is not gaining the consciousness between two attacks. All right, sir. Sir, what is the treatment of it? How to treat this? Sir, you will treat the status epilepticus by giving diazepam, lorazepam or midazolam to the patient. So remember, for your croc questions, you can treat the first line treatment for status epilepticus is diazepam, lorazepam, midazolam. They all of the drugs will be given in one option itself for the croc exam. This is it with this video. I hope you are getting the things. Let me know in the comment box and see you in the next video.